Very warm greeting, Dr. Robert H. Sorge, Doctor of Naturopathic Medicine since 1964. And we need to talk about a national epidemic. One that is so serious that at the rate we are going, half our nation will be taking care of the other half of the nation suffering from diabetes. This diabetes has reached the point of sheer epidemic proportion because of two enemies, and both of those enemies are not the Al-Qaeda people, not the foreign people, but people within who are supposed to be taking care of our health. And all of this is under the approval of our federal government agencies. And the enemy number one is none other than our junk food industry. For the sake of sheer profit, they have created an artificial chemical sugar that bypasses the filtration system of the human body and just leaps the blood sugar right on through the roof. And it is in almost everything without even the markings of what this stuff is. This is what is going on under the under the approval, under the blessing of our U.S. government protectors of our health. Enemy number one. Enemy number two is our drug-em-down allopathic drug medicine industry itself, better known as Big Pharma. When people come in to see the doctor very seldom tests out for pre-diabetic conditions. Now, here's something that most people don't know, and that is every diabetic, every adult-onset diabetic patient, is first of all a hypoglycemic. So shouldn't we be looking at hypoglycemia as the area that we look at to prevent the national epidemic? Oh no, not our big boys with the N period Ds after their name. What do? Oh, they fluff it off like you're imagining it. Let me give you a la-la land drug, rather than dealing with the very causation, which is toxicity, nutritional deficiency, diet, and exercise. The very things that can save our country and make it strong once again, rather than the weakness that we're dealing with because of this insipid medical profession. And what do they do when a person is actually diagnosed? Now remember, it takes about 20 years to reach this point of an actual diagnosis. We have many, many steps in between. We have hundreds of symptoms in between. Blood tests that can be done, urine tests that can be done, symptoms that you should be looking for. All that is ignored, all in the name of medicine, until finally one day the doctor says, well, you got diabetes. And what happens with diabetes? It takes 20 years off your life, number one. Number two, it's the biggest cause why people are on dialysis. It is the number one cause of brain fog, dementia, Alzheimer's disease. The number one cause in our country for heart disease, and of course the double, the triple, quadruple bypass surgeries, which people just love to get those. The reason that people have many, many symptoms, amputations. I can't begin to tell you how many hundreds of thousands of amputations, all done in the name of medicine, all because of our medical profession not sitting down with people, explaining in detail what needs to be done. What do? They throw a medicine at you, and that's supposed to be the end of the problem. And the medicine is more harmful than the good that it does. You see, when it first came out, it did save lives. But now, rather than explaining to people that, look, you must exercise, you must follow a food plan. There's certain things, believe it or not, are no-nos. You do not eat with this condition. It's never even mentioned. Oh, no, just more and more and more of drugging. Let's give you more and more insulin. Not realizing and never explain to people that insulin raises also the cortisol level, and insulin and cortisol both are fat storers. So the cause of our nation's disgrace of obesity, and now masters obesity and super and morbid obesity, is the result of the diabetics. What I want to talk to you about for a minute is a solution, a natural solution that is a very special product. It is patented. It is something that helps to get the cortisol and the blood sugar under control beautifully. It's called blood sugar cortisol control, and you take one of these 3 times a day as a preventative to get the blood sugar where it is under control. This is something we believe every American should be on. Thank you.